DREAMS Center for Diabetes Translational Research. DREAMS stands for Diabetes Research for Equity through Advanced Multi-Level Science. This is an ADK fund that I direct with colleagues at Stanford and at the Kaiser Division of Research. And we have a health policy research core through which work is coming through. Here, a little over 30 years ago, 2 years, Grant Colfax, the senior. I think maybe you probably remember this too, about 1 in 15 of our patients had type 2 diabetes. And now 1 in 2 of our patients have type 2 diabetes in our primary care clinic. So times have changed quite significantly. And it's not just that the patients aged with me. These are also new patients, younger patients. And so we're going to talk about really major event that has happened in a number of cities in California. And we're going to focus most of the presentation today on the 5 years with the San Francisco sugar sweetened beverage tax, focusing on the results of what really has been a remarkable community, public health, and academic partnership. And we have a number of speakers in the lineup today, and I'm going to introduce them as their turn comes up. And I have the honor of starting by introducing Grant Colfax, whom I've known for over 30 years. Grant is the Director of Health for the City and County of San Francisco, for those of you who don't know. And for the past 30 years, he has strived to improve the health and wellness through his work in clinical medicine, research, policy, and administration. He became Director of the San Francisco Department of Public Health in 2019. Overseeing the city's largest department. It has a $2.3 billion budget and more than 8,000 employees, including those of us at San Francisco General Hospital, Laguna Honda Hospital, 14 primary care clinics, behavioral services, and population health and prevention. And we've asked Grant to give some introductory comments before we begin.
Buddy, and I want to thank everybody here for coordinating Grand Rounds at this hybrid event to celebrate the 5th year anniversary of the soda tax. And I'm really delighted that Controller Cohen will be here later today to close out this event, and want to thank her for laying the groundwork, the legislative groundwork for passing the soda tax, which, as you all know, we all know, taxes are generally not a popular thing, right? Especially taxes as they relate to health can sometimes be really a challenge to pass through. But the important thing is this happened, and it is improving public health. I also want to thank, in that regard, the Soda Tax Advisory Committee for your guidance with regard to helping us figure out how to use these funds. There's so much scrutiny of this work. So I really want to thank you and thank the panelists today for your countless hours of research that we can show to the public that we are being held accountable to public dollars to make sure that they're improving the health and wellness of the communities. And I also need and want to acknowledge the DPH team, the HEAL team, Healthy Eating, Active Living team, for the countless hours that they put in, that including planning this event today. Christina and your team, I know you've been working extremely hard and extremely well with all the partners in the collaborations. So San Francisco is just one of four jurisdictions in California that passed the soda tax prior to the state level soda tax preemption law. And this year, again, marks the 5th year anniversary, and we've done so much. And we've also generated millions of dollars for the communities most impacted by sugary drinks. Dean mentioned earlier the fact that type 2 diabetes is at level communities that have been targeted by the soda industry. This is an important to remedy that action. Through the soda tax, the Department of Public Health has provided grants to community-based organizations working with low-income communities and priority populations to improve their health as it relates to diet-sensitive chronic diabetes and other chronic health conditions. And that soda tax benefits all San Franciscans, especially those in low-income communities and youth who are targeted and continue to be targeted by the beverage industry. So we've had a number of celebrations this week with regard to the soda tax anniversary. That will wrap up with a policy panel this afternoon. And today you'll be hearing from a dynamic panel who has worked tirelessly on a number of areas around soda tax, from the passage to policy to ensuring that we're strengthening the work with academia, public health, and community, which we know is a secret sauce in San Francisco success. So thank you. Heather, we will move forward, and back to Dean.
Thank you, Grant. And before I go on, I just want to take a moment to thank two of the organizers of this event, Melinda Martin from the Department of Public Health, and Jessica Davidman from the Department of Medicine here at the General. Thank you. So now it's my pleasure to introduce another a public health leader in San Francisco, Christina Goette. Christina is Acting Deputy Director for the Community Health Equity and Promotion Branch at the San Francisco Department of Public Health. In 2006, she co-founded the Shape Up San Francisco initiative, which played a significant role in laying the groundwork for the sugar sweetened beverage tax, and later worked with the San Francisco policymakers to develop SF's 2014 and 2016 excise tax measures on sugary drinks, and on her own time volunteered on the campaigns. With the passage of the 2016 sugary drink distributor tax, Christina's work has expanded to include staffing the Sugary Drink Distributor Tax Advisory Committee, as well as managing over $3.5 million in tax revenue each year for community-based grants. Christina?
Great. Thank you so much, Dean, for that beautiful introduction. It is such a pleasure to be here. It is so exciting. And I have a distinct pleasure of being here for the many reasons that Dean just mentioned, right? Got to help work on the education campaign, leading the first campaign in the Bay Area for soda-free summer in 2008. I had no idea that 15 years later, we'd be celebrating 5 years of a soda tax. It's just really incredible. And the team managing all this work is absolutely phenomenal. Couldn't do it without him. So anyway, I just want to talk a little bit about how it started. That is the first 2014 campaign, and it was an AstroTurf campaign paid for by the industry. And this is how it's going. Here we are 5 years later. So to get on with it, prior to 2016, there had been over 30 attempts to pass a soda tax in the United States, and only one had made it. It was Berkeley. Thank you. The first tax attempt was in 2014, with the industry spending over $10 million, and the community having about 250,000. It was imbalanced, sort of same as it ever was. And it didn't pass because it required a supermajority, 67% of the vote, because it was a dedicated tax, that tax was going to be dedicated to very specific things that had been outlined in advance. The measure got 56% of the vote, but that wasn't enough. So in 2016, the measure came back. And that tax was on the ballot 7 years ago today. So 7 years ago, voters voted for 1 penny per ounce on sugary drinks with added sugars. This time it was a general tax, meaning that it needed a simple majority. And the important piece of this is then that general tax could be allocated however our elected officials chose to see fit. Recognizing that, and also with the 2014 campaign, we recognize the absolute importance of community. Dr. Colfax mentioned the secret sauce in San Francisco. The community was absolutely vital to getting this to pass. And in so doing, they ensured that the legislation had language saying that the revenue would go back to the communities most impacted, and there would be an advisory committee making recommendations on where that funding should go. This campaign was even bigger. The industry spent $20 million, and we had about $2 million. So onwards. This is the amount of revenue collected over time. It is about $72 million. After mandatory set-asides, the advisory committee has made recommendations on about $50 million of this revenue. And we are extremely fortunate to have a phenomenal evaluation team, the Ramey and Associates, who have helped us monitor, track, and tell us what's happening with this campaign, with this initiative. And so what we see here are 4 key findings. Over the past 5 years, investments are going to the priority communities and places most targeted by the beverage industry. That's what we promised would happen. They've also included important structural changes and systemic access to healthy food and oral health treatment. Those are the longer lasting kind of changes that we're always looking for. And they're starting to change norms around sugary drink consumption, around drinking more water. So 14 out of 21 congregations in San Francisco are now more regularly serving water as opposed to sugary drinks, and some don't serve sugary drinks at all anymore. That's very significant. 81% of program participants are now able to drink water more often, and they're water more often as they report, and 83% are eating more fruits and vegetables on a regular basis, also very significant. And lastly, the investments are increasing economic opportunity in the communities most impacted. So we are meeting what we said we would meet. And if I could get this. Yeah, tried that. So in the programs, we've had the percentage of participants in the programs that are BIPOC, thank you, are about at least 60%. It gets higher, but not. When you look at where the allocations are going, most of the funding has been going to nutrition security, followed by physical activity. And actually, let me back up. So nutrition security means people are getting food, whether it's through vouchers or food boxes or meals. Physical activity is next, and then a lot of nutrition education, as well as oral health and community building. So to get to that place, we've been really working to ensure that we have a range of intervention types, because we need that spectrum to get the work done. Most of the funding has gone to program and services, but we've also been supporting policy and systems changes. And in doing so, you can see that in the interventions and how they play out. We're able to start mitigating the health inequities and creating healthier communities through things like market match and healthy food purchasing vouchers. They brought in $2.4 million to low-income families and supporting 92% of mostly BIPOC businesses. So that is a big, important piece of how those food vouchers play. But they also support the individual being able to keep their healthy habits going after participating in programs. So the soda tax has so many levels. There's so many stories. I wish I could tell you more about it. We've got a lot of people being paid with sugary drinks funds that are both BIPOC and San Francisco. And there's a lot more data, and I'm being given the hook, so I'm going to step away, but I want to point out to you that this is where you can get more data. And because we ask all our funded agencies to put this up at their presentations, I'm doing the same. Thank you, everyone, so much for being here, for being online. And Dean, back to you. One thing, there's a policy, the virtual policy panel is on Thursday from 1 to 3, and we'll get you more information.
Thank you. And we're going to try to get the video monitor part of this off of the screen so that it doesn't block people's slides. Give me a minute. While we're doing that, I'm going to introduce our next speaker, Roberto Vargas, also a friend. What a coincidence. All these people are my friends. How is that? Which came first is the question. He's Associate Director for the Center for Community Engagement and Senior Staff for the RAGE program of UCSF's Clinical and Translational Science Institute, CTSI. Vargas has helped shape health policy and practice at the municipal and national levels on chronic disease prevention and cancer care, primarily by leveraging the expertise of UCSF scientists and community health advocates. In the fight to pass a soda tax in San Francisco, Vargas helped convene UCSF experts, local policymakers, and community leaders to shape SSP water policy and investment to work for CTS. Roberto has served as co-chair of the San Francisco Sugary Drinks Distributor Tax Advisory that he will mention in his talk. And what do you think, guys? No go on the buttons aren't helping us. Okay, that's our main finding. The sugar sweet in the right in the camera box. You'll never know. Right. Go ahead.
Thank you, Dean. Where do I toggle the slides, Dean? Here?
Should be.
All
Give
right.
it, give it a shot. There you go.
All right. Thank you. So I want to make the point, good afternoon, folks. I want to make the point to begin with that all of this effort around sugary drinks and ultimately water equity, it's a SSBs and water equity, were done by way of collective impact. And when we began that work of collective impact, actually that term had not been coined yet out of the Stanford Journal of Social Innovation, I guess it was. But you know, it seemed like the right way to go. So that's where we began. We began actually with UCSF getting very interested in understanding how best to deploy our research resources in particular because of our work at the Clinical Translational Science Institute, the interest in translating discovery into changes in the world, and in this case, changes in public health approach and policy. So all this to say, you know, we began with partnering with CHEP at the beginning and then engaging community leadership. And I'll talk a little bit about how we did that stepwise and primarily in the realm of education, research, policy, and environmental change. Okay. And so I love this graphic, number of reasons. And one reason is so that we tried to do multiple levels. So today we're focusing on the policy level, but our work spanned, you know, multiple levels all the way down to the individual. Okay. And we began by taking a look at disparities, right? So in coming together as the San Francisco Health Improvement Partnership, SF-HIP, we began to identify what were the priority health issue areas that we needed to address together collectively. And Dr. Tomas Aragon pointed out to us, you know, the most years of life lost. Of those years of life lost, the primary suspects of the top 9, 6 are related to what we eat or the level of physical activity in our lives. And so we decided to focus on chronic disease to begin with. And we mapped disparities. These maps were developed by Marianne Zito, Dean Schillinger, and then myself on the right. I developed that with communitycommons.org. I don't know if that web-based tool is still available, but we're able to map SSB purchases, and they overlaid similar to disease outcomes and disproportionate burden in San Francisco. And as Dean pointed out earlier this morning, also overlaid to maps of redlining in San Francisco. And so we engaged initially folks in local communities of color, leaders in Latinx community, African American community, Asian Pacific Islander community. And initially folks were saying, you know, we're not worried about soda, like we're worried about housing, we're worried about violence, we're worried about employment and other things that are really of a priority to our community. And so ultimately, you know, the visualization of that data of disparity was really effective at communicating to folks why they needed to be concerned when we showed the disproportionate impact relative to diabetes hospitalization, heart disease, stroke, and other things. And so initially it began with education partnerships. So beginning to deploy promotoras, lay health workers in these local communities of color to educate folks about the harms of sugary drinks and the alternatives. And that began to strengthen, you know, community buy-in to this topic. And then also Laura Schmidt and others led the development of sugar science so that we had reliable education information that we knew not to be tainted by industry. That was super important, that sugarscience.org resource. And Laura, Schmidt was, at least for me, the first to begin saying we really need to take a look at policy interventions and we really need to take a look at a soda tax. And she was talking that up with many of us, but most folks weren't ready when she began saying that in 2009. But these are other ways that the university held our stake. So, influencing and sharing, building the capacity of local policymakers around understanding the science. They help build our capacity to better understand the politics locally and the policy possibilities and the barriers. We engaged in research, both community-based participatory research and traditional research, engaging communities to understand their perspectives around different policy interventions and what they were willing to support or not. Evaluation, as we'll hear more from Dr. Madsen later about, as one example of the many things that we evaluated. And we deployed our learners, graduate and undergraduate students, to help collect data in communities about where folks wanted water stations put up, understanding how folks felt about the different policy proposals that we knew to be evidence-based, et cetera. And then also, as I mentioned with sugar science, the development of authoritative educational materials. So we learned a lot from the research, including, folks wanted to protect their children, but they wanted things to remain affordable. They didn't like the idea of a tax on consumers, but they liked it applied to distributors. And they wanted better access to water they could trust. So after the first 2014 tax failed, the mayor came and asked us, well, what other policies can we do? Because he saw how much support there was. And so we proposed 3 other policies. One was struck down by the an ABA, American Beverage Association lawsuit, another pulled by the city attorney. The no purchases of sugary drinks still stands. And then we worked with local hospitals to adopt hospital institutional policy. And we partnered to work on water access. So lots of work done. I just want to say the STD TAC continues to function. It's very important. Abby Cabrera's here, co-chairs it. And what's important about the soda tax advisory is it convenes experts, including folks with scientific expertise, community engagement, expertise, representation of community, and they make recommendations to the mayor for how to spend the soda tax. Structural inequity exists such that community has to continue to reapply to be on the committee, but city reps do not. And we need to do better around how we engage youth representation and youth voice there. So please pay attention to the soda tax advisory. Please urge your local policymakers to renew it because it sunsets in 2028. Thank you very much.
Thank you, Roberto. I'm going to now shift gears and talk about some of the NIH and CDC funded evaluations that we've been able to do subsequent to the taxes in San Francisco, as well as other parts of the Bay Area. This research has been supported through multiple sources, including originally the California Endowment, the National Institutes of Health through an R01, and the P30 Center grant that I mentioned in my introductory comments, and a CDC U18 grant. The investigative team includes myself, Dr. Kristine Madsen, a wonderful colleague whom you're going to be hearing from next, Dr. Sanjay Basu, a graduate of our San Francisco General Hospital Primary Care Residency Program, Justin White, health economist, Rita Hamad, a social epidemiologist, Scott Kaplan, a former mentee of Chris Madsen, and Sofia Boas from UC Berkeley. And this work involves essentially what's known as natural experiments research to evaluate tax-related changes in a number of domains, including sugar-sweetened beverage-related social norms. This is based on survey-based data. SSB prices and purchases, which is based on retail scanner data, which are data that typically firms use to monitor the success of their marketing and sales, some cost effectiveness analysis through the use of microsimulation, and then SSV-related health outcomes in specific gestational diabetes through data obtained through birth certificates. So this is work led by Emily Altman and Dr. Kristine Madsen. And really the question was, to what extent are social norms related to sugar-sweetened beverage consumption changing in the Bay Area? Now, the Bay Area has been a fairly intensive geographic region with respect to exposure to anti-sugar sweetened beverage messaging because of the number of tax campaigns that have been endemic to our region, including a failed tax campaign in the city of Richmond. And as you can see, overall, on an annual basis, there are pretty consistent reductions in the degree to which people report that their perceived consumption of their peers is going down across soda, sports drinks, and fruit drinks across all of these 4 cities. With respect to folks' attitudes about the healthfulness or lack of healthfulness of sugar-sweetened beverages, we've not seen that much change, with the exception of San Francisco, which has observed a reduction in the healthfulness with respect to sports drinks and fruit drinks. Now, none of this is looking at the specific effects of the tax. If we then negate out everything except the effects of the tax, what Chris and Emily found was that in the city of Oakland, there are independent effects on changes in perceived consumption, so reductions in perceived consumption of peers among for sport drinks, and in San Francisco, changes in attitudes about the healthfulness of fruit drinks. So some mild to modest independent effects on social norms and larger effects on social norms across the Bay Area. Whether or not you can attribute it to the tax itself, one cannot say. With respect to sales of sugar-sweetened beverage tax and the prices of the sugar-sweetened beverages themselves, Scott Kaplan, in a paper that's now in press at JAMA Health Forum, examined something known as the price elasticity, which is an economic measure that tries to connect or define the relationship between changes in price and changes in purchasing. He did this using Nielsen sales data across 5 major cities that have been subject to a sugar-sweetened beverage tax, using a synthetic control model in which essentially he creates 5 make-believe Philadelphia, Boulder, San Francisco's, Oakland's, and Seattle's across the country through very sophisticated modeling. That has to do with a range of factors, including population size, demographic makeup, et cetera. And what he found was, while there was variation in the change in price across cities, mostly as a result of different legislation related to how much tax was being imposed on the beverage, that there was a concomitant reduction, that's in orange, in volume purchased, such that the price elasticity was essentially -1, meaning for every % increase in price, there was an equal % drop in consumption across these cities. Shown visually, here is the aggregate effect across all of these cities, netting out any changes in consumption that we observed in the simulated comparison cities. And what he found was a 33% increase in prices, that's on the top panel, relative to the implementation of the tax in each city, and a 33% reduction in consumption in the tax cities relative to the untaxed cities in aggregate. Now, because of statistical specifics related to synthetic controls that are way above my simple country doctor ability to process, we don't have a lot of statistical power at the individual city level when we use synthetic controls. But nonetheless, we can look at the patterns of reductions in consumption across a number of cities. And you see that essentially, while the p-values may not always be less than 0.05, we see very similar patterns relative to tax implementation of fairly robust and sustained reductions in consumption, including in the city of San Francisco, whose effect, while not statistically significant, was about 31% reduction in purchasing. So fairly solid evidence using sales data that purchases of sugar-sweetened beverages have fallen in a sustained fashion in association with the rise in prices. Now, that may be nice. It certainly generates revenue for the city to redistribute and reinvest in low-income communities, and we'll hear more about that in a minute. But what might this mean from a health standpoint? And Sanjay Basu carried out an analysis within Justin White's paper that was published in PLOS Medicine, where he calculated the cost savings and qualities gained for every 10,000 residents. In this case, he was looking at the city of Oakland. Here he used sales data from the company IRI and was a statistically significant reduction in purchasing in Oakland of about, I want to say, Chris, was it about 30-some% or so in Oakland? And with those data, was able to calculate the healthcare cost saving, societal cost savings that would accrue over 10 years per 10,000 residents of Oakland and over the lifetime, as well as the quality of gain. Actually, if you just look at healthcare costs, you get about $100,000 of cost savings per 10,000 people over 10 years, and over $1 million in cost savings per 10,000 people in Oakland over their lifetime. And when you take into account the tax itself, those numbers are slightly reduced to a little over 100,000 and to 1.2 million. In addition, he found that there were 94 quality adjusted life years gained for every 10,000 residents of Oakland over 10 years, and nearly 1,000 over the lifetime. Now, I wanted to point out these are very abstract numbers. So how do you put this cost effectiveness analysis into perspective? And I just want to remind you, we've got about $100,000 of savings per 10 years and 94 qualities, right? For 10 years. Traffic-related air pollution measures, such as low emission zones, have a cost. They actually cost $3,000 per quality saved. Whereas in this case, we saved $100,000 to save 94 qualities. A clinical child obesity intervention would cost $774 per quality saved. Smoke-free workplace policies, for which we have Stan Glantz here to thank, have a cost of about $700 per quality saved. And then a $1 cigarette tax, remember that's about a tax of about 20 to 40% increase in price across states, plus an anti-smoking media campaign, generate cost savings that are quite significant, $500,000 to $800,000 per quality saved. So as a result, we conclude that the sugar-sweetened beverage tax is estimated to be less cost-effective than a cigarette tax, but more cost-effective than a smoke-free workplace policy and air pollution measures, and certainly more cost-effective than a clinical childhood obesity intervention program. Now, all of these are intermediate markers, and of course, the holy grail is to see what effect reduction in purchasing might have on health outcomes. And for those of you who work in the diabetes space, you know it's one of the most frustrating public health problems to tackle, because any intervention now will not yield fruit, for another 10, 15, 20 years. But my colleague Rita Hamad and her team brilliantly thought of the idea of looking at gestational diabetes, which is a condition that is very sensitive to dietary changes in a very, very short, constrained period of time. And sugar-sweetened beverages, of course, are the largest source of added sugar consumption for pregnant women. There is evidence that excess sugar intake is associated with untoward perinatal complications, but we don't know if a sugar sweetened beverage tax would impact gestational diabetes. And what I can tell you briefly is that she showed that sugar sweetened beverage taxes across, it was 6 cities in comparison to all other cities that were non-taxed in the United States, led to an absolute reduction of 2.2 percentage points, and gestational diabetes in America now affects about 6% of women. So 2.2 absolute reduction, which is about a 40% decrease in gestational diabetes risk in this period of time, which is almost, I will say, too good to be true, because it basically is, we're reducing our consumption by about 30%, and we're finding a reduction in gestational diabetes of a nearly equal amount. Interestingly, Hispanic women had the largest decrease in gestational diabetes risk. This finding has not yet been published, but it was about a 60% reduction. And African-American women also had a similar reduction, but the confidence intervals were quite wide there. So we're not quite sure. And they are going to be repeating this analysis in California using much more detailed outcomes data beyond the birth certificate data. They'll be using HCI data, formerly known as OSHPD data. So their conclusions were that policies to reduce sugar intake, and specifically sugar sweetened beverage taxes in particular, reduce diabetes risk among pregnant women. And because gestational diabetes is associated with untoward outcomes for the neonate and infant, probably will improve child health as well. So I'll just summarize. And I'm sorry, here are the subgroup analyses that show the disproportionate reductions in gestational diabetes among the Hispanic subpopulations in these cities compared to those in cities that were untaxed. So the summary of the evidence of tax effectiveness, which is perfect timing for Malia Cohen's arrival, so she knows what to comment on, is we observed mild to modest effects on self-reported sugar-sweetened beverage-related social norms in the Bay Area attributable to the taxes in the context of social norms falling quite significantly across all Bay Area cities, making it difficult to disentangle the tax effects. We also found robust declines in sugar-sweetened beverage purchasing, about 30%, with little evidence of cross-border shopping. I will say that we are unclear about the effects on actual consumption, because just because you purchased a big gulp doesn't mean you actually consumed it. And I will say, while it is reasonable to expect there are equivalent effects of the tax on consumption across socioeconomic status, race, ethnicity, et cetera, this is not known. And we really need more research to ensure that the tax is having the progressive effects in terms of health outcomes for marginalized populations. The microsimulation model that Dr. Basu implemented suggests quite significant cost savings and qualities gained in line with other very well-established public health interventions. And the sizable drop in gestational diabetes rates were in line with the sizable reductions in sugar-sweetened beverage consumption, with disproportionate benefits among Hispanic populations and possibly among non-Hispanic Black populations, which provides some reassurance that this is not a quote-unquote regressive tax. We also need to study the additional health impacts and health economic benefits of revenue-based investments in public health and nutrition programs, because these have not been evaluated. In other words, the cost effectiveness analysis that I showed was just based on reductions in sugar-sweetened beverage consumption and did not assess any positive health effects of, for example, the fruits and vegetables vouchers program funded by the Sugar Sweetened Beverage Tax Advisory Committee and the mayor herself. So with that, I'm going to pass it over to my other friend and colleague, Dr. Kristine Madsen, who's going to talk about how, beyond San Francisco, how tax revenue is being invested, and talk a little bit about how the industry is trying to undermine these advances at a state and national level. Chris?
So I'm just going to briefly zoom out to talk about successes and challenges nationally with SSB taxes. So across the 7 cities in the US that currently have taxes, we did a study a couple of years ago and found that the annual revenues generated from the taxes were about 137 million. It's still very close to that. It dropped off a little bit post-COVID, but it's close to 130 million now. And then the question is whether or not cities are actually doing with those revenues what they said they would. And we found that cities were investing revenues as promised. So overall, across all 7 cities, 67%, so 2/3 of the funding were dedicated to health and human services, or human and community capital is what we were calling that. So these are things like early childhood development, youth development, economic development programs. And Christina was mentioning that San Francisco did many of those. Another third almost was in health promotion. We saw a lot of those results in San Francisco. And what I love about this is that you can see the little pop-out graphs over here to the right, that cities use their funds very differently. So if we look at the green graph above for the human and community capital, Philadelphia, I promise that's Philadelphia, the tall bar there, they used almost 100% of their funding for early childhood development centers. That was what they had decided they wanted for their community. So the flexibility of something like a local SSB tax allows you to actually dedicate it to what your community wants to do with it. And one of the things I wanted to highlight, what Christina and Roberto both noticed, you noticed the SDDT. Lots of places call it an SSB tax or a soda tax. They specifically, San Francisco calls out that it's actually a sugary drink distributor tax. And that's really important because when we talk about successes, how that revenue is used is incredibly important. Roberto also talked about the fact that communities don't care quite so much about sugary beverage consumption. They care a lot more about whether or not their kids are going to have jobs that are going to make it through their high school years. And this is one of those points that's very important because the revenue matters to me far more than what happens to consumption. And importantly, it's a way of holding beverage corporations accountable for the health harms of their products. So whenever we talk about this, it's important to call it out as a distributor tax. This is not a tax directly on people. This is on distributors because their products are causing harms. So thinking about the challenges, these are the 4 states in the dark green that actually have taxes. 4 of them are in San Francisco, or in California. You can see Illinois is up there because they had a tax, but it got repealed after 2 months. I will say theirs was a sales tax, so directly on consumers. It was not a distributor tax, which was one of the problems for them. So all of these taxes passed between 2014 and 17, all were implemented by 2018, and nothing has happened since. So there was this huge, in a very short period of time, this really innovative policies happening across the country, and then they stopped. So one of the big problems was COVID. Grant was saying, taxes aren't popular. They're extremely unpopular when the economy is tanking. But the other big issue is preemption. So just to define preemption for you, preemption is, and here you can see that the dark red is states that now have local SSB tax preemption. So state preemption is when the state says local jurisdictions can no longer pass legislation on a particular issue. Since 2018, 4 states now have preemption, meaning that cities in those states cannot pass taxes. The state could pass a tax, an SSB tax, but those cities could not. Who do you think is behind this? Obviously, it's American Beverage Association and corporations. So they're using their power and their profits to actually do an end run around democracy. And in California, because voters approved taxes, this is literally an end run our democracy. We cannot, as a city, that we litigation, but they're willing to do it. And I wanted to mention that Change Lab Solutions was actually the group of lawyers. It's a nonprofit, but it was their lawyers who actually led the fight against preemption. So there's a lot of hope out there. And I would just urge you not only to get out the vote, but also to find local legislation, local communities, and local organizations like nonprofits, like Change Labs, and support them so that we can try and wrest that power back from big corporations. And with that, I'll turn it back to Dean. I forgot. This is a picture of our former governor, Jerry Brown, standing around with representatives from Coke, Pepsi, and the American Beverage Association just days before preemption happened in California.
At his mansion, right? Dinner at the mansion. And I have to say, I failed to introduce you properly, Chris. Chris is a professor at UC Berkeley School of Public Health. She's a pediatrician, an incredible research scientist with expertise in design and evaluation of interventions related to cardiovascular risk in youth and health inequities. And a lot of her research focuses on improving the food system and reducing health inequities. And she's just fabulous to work with. So now I get we've bookended this presentation with Dr. Colfax and State Controller Malia Cohen. Malia Cohen was elected in November 2022 as State Controller following her service on the California State Board of Equalization, where she is responsible for administering California's $100 billion property tax system. Prior to being elected to the Board of Equalization, she served as president of the Board of Supervisors of the City and County of San Francisco. I had the pleasure of presenting to her on a number of occasions, and she was incredibly gracious in that role. As a supervisor, she served as chair of the Budget and Finance Committee and the Audit and Oversight Committee. And Controller Cohen has championed policies and programs that protect public health, foster economic development, promote new affordable housing, and create good jobs. She has been instrumental in several San Francisco-based initiatives to curb sugar-sweetened beverage consumption, and she is a native of San Francisco. Malia, please come on up, and any closing comments from you?
Good afternoon. This is, it almost feels like a victory lap, to tell you the truth. When I hear the data, I'm astounded at how much money we've raised too. $50 million in 5 years. That's so impressive. There's many things I want to say. First, I just want to acknowledge Dean Schillinger spent so many hours in front of me in committee testifying. I feel like I have a master's degree in public health, just being educated on the facts of what added sugar does to the body. And quite honestly, it was through these presentations and the presentations of nurses, healthcare practitioners, people who had suffered from preventable diseases like diabetes, just coming to committee and making the presentation over and over again. I think we must have had you about 3 different times. Thank you very much for your presentations and your unwavering support. And I also want to recognize Dr. Stan Glantz. He has also been a phenomenal place of inspiration for me for actually my entire career. I think you're retired now, is that right? Kind of, sort of, kind of. I understand. But I just am grateful for the opportunity to say thank you. First I know Frida, his daughter. She does an incredible amount of work just getting women elected and convincing women, particularly women that are mothers, to run for office. And then I met Dr. Glantz separate and apart from her. And then when I realized that the two were related, I thought, of course, the fruit doesn't fall far from the tree. So I just wanted to just publicly acknowledge the hours of testimony, your research, the things that you have done to educate people and to try to make San Francisco and just the overall world a better place. Thank you. I think that you both have done an incredible job. If you were to check out today, your mark would have been is felt on this world. And so I'm very grateful. I have been touched also from this project. 5 years since it's been passed, but it's been, I think, in the making since 2013, Christina was telling me. And this road has brought me so many wonderful people in my life. And I think that this is the quintessential example of what good policy, when you have a good policy maker and you've got scientists and professionals, and when you come together, how we are able to shape and make change happen. So don't give up on elected officials. And it's so funny because I was laughing with Mayor Breed, how I had remembered I set up a particular hearing briefing for her and to come to the Rules Committee to hear about the effects of sugary beverage, because she at the time was thinking, my grandmother drank Cokes every single day and she lived to be blah, blah, blah. You know the story, right? So I set up this hearing for her. I said, where are you? We're in committee. We're ready to get started. She's like, oh, I'm in Napa. I forgot about that. And I said, that's fine, but you better vote my way. A little insight into the decision-making process. It's lighthearted now, but I was pissed when it was going down, because it was quite a battle at the Board of Supervisors, really, even in the ethnic media. and the newspapers, how the sugary beverage industry would pour money in and the advertising and would literally buy a position against us. And so I also want to recognize Supervisor Wiener, now State Senator Scott Wiener, because he took the first measure to voters. And I think that that was very instrumental in educating voters so that they would know and learn about the effects of sugary beverage. That's how we were, I think the second time we were able to be very successful. That we also pivoted from the first campaign to the second campaign is centering communities of color front and center, the people that are actually most adversely affected by the added sugar, and the people who are living in food deserts. Now, I think that that also was a shift in the game. And then not to mention, I think finally Bloomberg's money came in. Do you remember that? The folks that were on the campaign, how it took a long time for us to get our campaign money. Could they do it? Can we not do it? I mean, it was just nuts. And I love the fact that we did it with our sister city in Berkeley. So here we are today, 5 years later, to stand back and look at the data and we see how it has an impact. I mean, this is a perfect example of what public policy, good public policy can do. And so everyone that's been affected, that had their hand in making this policy dream a reality, I applaud you. I applaud you, because at the time when we were going through it, it felt like the quintessential David and Goliath matchup. And Dr. Colfax, I know this legislation precedes you, and you get to just hear about the good stories from the campaign trail. I'm surprised we don't have the consultant in here that ran the campaign, but it was just phenomenal to see how San Francisco's come together. Internationally, this movement that we have started here has gotten a lot of attention. I've been interviewed by Parisian journalists as well as German journalists just as early as this year. And it's just incredible to see how our counterparts, our friends that are over in Europe, how forward thinking they are. They truly wonder why we are so backwards and why Americans don't get it and why we don't take better care of ourselves. And I don't have an answer for them, but I do hold this legislation up as a shining example of that people do care. And there are a small number of folks that are committed and have dedicated their lives to making this effort a worldwide phenomenon. I didn't see any data in here from Mexico, but I know Mexico's numbers are staggering. Their consumption rate has decreased, and they have, I think with their money, they developed healthy and clean water supplies. And again, changing the way people's their relationship to food. I want to talk about the American Beverage Association, because now I'm in Sacramento. And what I see on a daily basis it is really shocking. It's kind of like what your worst nightmares would be made up of. When you think about the lobbyists that do walk the halls, that do grease the hands, when I say legally, I mean, everything is transparent, everything is reportable, but they are spending a lot of money to influence state government. And I appreciate your words, the work that you're doing at UC Berkeley to alert people about how lobbyists in the American Beverage Association is spending their money to influence legislators, which is really hampered our ability to get this movement across the entire state of California. I'm delighted to hear that there are lawyers that are going to challenge this preemption. I remember being on the Board of Supervisors when I first got word, and I made a couple calls to a few legislators. I think David Chu was actually one of the folks that I called. He was with us, but he painted a very grim picture about what was happening. And it's true, that is how business is conducted. I do want you to remain hopeful. I'm there on the front line in Sacramento, trying to hold the line when it comes to preemption, when it comes to good pieces of legislation that are going to have a positive effect, not being scared away when opposition talks about regressive tax, but standing strong and standing firm. I'm also grateful for Ed Lee's legacy, because Ed Lee promised that he was not going to spend that money, spend those tax dollars in any other place other than in the adversely affected communities. And he has been true to his word. And then I also made Mayor Breed swear to it. And she too has been true to her word. And I recognize the community coalition that has come together to hand out community grants. I don't know if you attended any of the events on Saturday, but we had a fantastic event in the Bayview at a farm, which I also established. I mean, come on. I gotta pat myself on the back. But I did. And also to establish, again, addressing living in a food desert, addressing and correcting and educating people how to take food from the earth, how to cook it, how to make it delicious. And also there's an economic engine there, being able to take your products to market. So that's a lot to say. I apologize that my remarks aren't tightly framed, but I'm just really speaking from my heart because this is a moment of great pride. I'm very excited for San Francisco, to the volunteers that oversee the dissemination of the dollars. Continue doing a good job. Thank you very much for all of your work and your volunteerism, and let's keep those studies going. Thank you.
Thank you, Controller Cohen. I realize that it's 1 o'clock and people might have to go back for their clinical work, for their teaching responsibilities. Please do that. Those on the Zoom may have to as well. We're going to stay here, if it's okay, Neil, to stay here for a few more minutes. If people wanted to ask questions of any of the panelists or of Controller Cohen, please feel free to do that. I think